Welcome, class, to the Week 2 presentation for ME105. Hopefully, with Week 1 under our belt, we're feeling a little more confident in our classroom and our expectations and just a little bit more of the flow of the course. If you're not, definitely reach out to me. I'm always here to help you. Again, you're never in this journey alone. So if you feel like you have questions that aren't being answered or if you need additional assistance, definitely seek me out. Let's dive right into our material for this week. For week 2, our focus is going to be on 3 chapters of study, so you will want to read all 3 chapters in your textbook. Chapter 3 focuses on essential prefixes and more, so we're going to look at the prefixes a little more deeply than we did last week. Chapter 4 focuses on diagnostic procedures and therapeutic interventions. And Chapter 5 focuses on the body as a whole. We touched on the body as a whole in week 1, so we will expand on our knowledge that we already have on that and go a little bit deeper this week. In terms of prefixes can change the meaning of a word by a number of different ways. They can mean numbers. Some examples are sorry about that. It looks like my slide kind of didn't want to work with me for a second. Mono or uni means 1. Bi or di means 2. Tri means 3. Quad, quadri, or tetra means 4. They can also change the meaning of a word by meaning quantities. So diplo would mean double. Hemi or semi both mean half or partly. Hyper means excessive or more than normal, and hypo means beneath or below. The way I like to remember those two, hypo, below, they both have an O in them, so I find that a little bit easier to kind of remember those prefixes. Multi or poly means many. Prefixes can also change the meaning of the word by indicating a position or direction. Some examples, ab, as in A and B as in boy, ab means away from. Ad means toward. Anti or pre means before in time or place. Circum or peri means around, and dia means through. We can also change the meaning of the word by using a prefix to indicate time or size. Some examples are anti, pre, or pro means before. Post would indicate after. Macro, mega, meglio all mean large or great, and micro is going to indicate small. Negation is a way we can use a prefix to change the meaning of a word. So a or an, those both indicate no, not, or without. An in, as an in, will indicate not or within or inside. We can also be more descriptive by using a prefix. Anti or contra indicates the prefix will mean against. Dis, dys, will mean bad or difficult. Mal, mal, means bad, and pro means favoring or supporting. So all of those give examples of ways that prefixes can really change the meaning of our word. Let's look a little bit more deeply into some terms that I definitely want you to remember for your quiz this week. And they may seem a little complex, but let's go through these. Para-appendicitis. So, appendicitis is going to mean inflammation of the appendix. When we add that prefix para, then we're indicating inflammation of the tissue adjacent to or near the appendix. Bradyphagia. Brady is going to always mean a slowness. So this particular term, bradyphagia, means an abnormal slowness of speech. Anticonvulsive. That prefix anti is going to mean to prevent or against something. So anticonvulsive is an agent that is used to prevent convulsions. Hypoparathyroidism. Our parathyroid is a gland, and if our parathyroid gland is not secreting at its normal rate and it's below normal, then we have hypoparathyroidism. That's a below normal secretion of the parathyroid gland. Anaerobic, that AN prefix is going to mean without. So anaerobic is the ability to live without oxygen. Looking next, we're going to kind of switch gears and talk about diagnostic terminology. So understanding diagnostic terminology will help you with all the body systems. Remember how to form the plurals, especially of diagnosis and prognosis, and you can see those on here. Diagnoses, prognosis. Some abbreviations are also listed on here. DX is the common abbreviation for diagnosis. SX is a common abbreviation for symptom. Acute versus chronic. Did the condition just start or has it been going on for some time? And then there's lots of tests that can be ordered. There's some clinical testing, laboratory testing, imaging, and specimen testing. All of that's covered really well in your book, so please make sure to look over those areas. We're going to talk just in general about some basic examination procedures, just because these are just great reminders. The vital signs, when we hear that term, we're generally talking about pulse rate, respiration rate, and temperature. Blood pressure is sometimes considered one of the vital signs, depending on your source. Sometimes it's not. I like to always include it in the vital signs because it's part of a normal examination. When you go to the doctor, normally they're going to do your weight and blood pressure as well as these other things. When we are looking at blood pressure, there's two numbers involved. One is systolic and one is diastolic. Blood pressure is often abbreviated BP. The systolic blood pressure indicates the pressure on the arteries when the heart is contracted, and the diastolic shows the pressure when the heart is relaxed. Upon basic examination, what we're doing is we're inspecting, we're palpating, we're percussing, and auscultating. Those are how we get our general signs of one's general health. There are some specialized procedures I want you to be aware of that your quiz focuses on. We are not going to go through every specialized procedure talked about in your book. However, I will touch on the ones that are most important for your quiz. Endoscopy. So an endoscope is an illuminated instrument generally introduced through a natural opening. And here we see an endoscope that's being introduced through the mouth. So the endoscope is being used to examine the interior of the stomach by way of the esophagus. So we went down the mouth with the endoscope to the esophagus, from the esophagus into the stomach. On the right-hand side, we actually see a radiograph of that endoscope so they can check its placement. And then through the endoscope, they released some X-ray dye to light up some various parts of the body. Another procedure that your quiz focuses on is catheterization. So a catheter or cannula is a hollow flexible tube that can be inserted into a cavity of the body to withdraw or to instill fluids, perform tests, or visualize a vessel or cavity. The introduction of the catheter is called catheterization, and to introduce a catheter is called catheterize. Next are some diagnostic radiology terms. So here we see the breakdown of the word radiograph, and you can see that radii, with that combining vowel O, that root means radiant energy. And when we add the word graph behind it, we're talking about a picture. And then we can see radiography broken into its parts as well. The one in particular I want you to focus on for your quiz is computed radiography. In computed radiography, the image data is actually digitized and immediately displayed on a monitor, or it can also be recorded on film. The term opaque, and we see the term on here, radiopaque. Opaque means light does not shine through, so radiopaque means X-rays do not penetrate the structure, and it becomes white on the image. So when X-rays are not getting through, we see white. When X-rays are getting through, we see various levels of gray. So radiolucent means the X-rays can penetrate, and those structures are various levels of gray. Non-invasive means the skin is not broken. Invasive means entry through the body cavity or an interruption of the normal body function, such as to incise, or an invasive procedure would mean that we are going into the body in an unnatural way. Another term I want you to be familiar with for your quiz, thermotherapy. If we kind of break the word apart, this one should not be one that's hard to remember. Thermotherapy uses heat to relieve pain or speed healing, and here we see a lady with heating pads on her back to hopefully relieve her back pain. Moving right along, some terms I want you to know that relate to our body as a whole. Supine versus prone. We didn't touch on this very much in week 1, so I wanted to make sure to touch on it during week 2. When we hear the word prone, that means we are lying face down or we are laying on our stomach. Supine is when we are laying on our back. We can supinate or pronate the parts of our body. So if we supinate our arm, that permits our palm to turn up. If we pronate, that's turning our palm downward. The last position we see on here is the lateral recumbent. Recumbent just means you're lying down. Lateral means they're lying on their side. Next, we're going to talk about some important combining forms. We will not go through all the combining forms that your book focuses on. However, we will touch on some of the ones that are more important for your quiz. Here we see abdomen O indicates the abdomen, acro meaning extremities, Belfar O, eyelid, and there's one word I want you to be familiar with in regards to the eyelid for your quiz. It's blepharoptosis. That's a drooping of the eyelid. Cephallo means towards the head. Chiro is indicating the hands. Cysto can mean the cyst, a bladder, or a sac. Dactylo are our digits, and our digits are our fingers and our toes. Laparo is the abdominal wall. Moving on, a few more to go over. Omphalo is going to indicate the umbilicus region. Onycho is the nails, so your fingernails and toenails. Pelvi indicates pelvis. Peritano is the peritoneum. Podo indicates the feet. Soma or somato is the body just in general. And the last one I want to draw your attention to, thoraco. This is going to be the chest or thorax. Your quiz asks a couple of terms regarding that root. The first one, thoracotomy, that's a surgical incision of the chest cavity. The next one, thoracodynia, that's pain in the thorax, and it's distinguished from chest pain resulting from a heart condition. So those two terms I definitely want you to remember for your quiz. Some other terms that are going to be good to know. There was really no good place to put these in, so I kind of just threw them in here towards the end. Lacrimination, that is the medical term for crying. And actually our tear ducts are called our lacrimal ducts. So if we remember that lacrimination will make more sense. The cryolithasis, this is the presence of a tear stone. Lithe is going to be the indicator of stones, and it's used in various parts of the body, such as kidney stones, gallstones, and in this case, we're talking about tear stones. At this point, that concludes the highlights of the information that I definitely want you to know for your week 2 quiz. Of course, definitely read through all 3 chapters. That will help you for your assignments as well as your discussion. If you have any additional questions or things that I might not have touched on that you need further help with, definitely reach out to me. As always, our information presented today did come from your textbook, so it's an excellent resource. Hopefully your textbook is on its way if you haven't received it already. Thank you so much for your time and have a great week.